So as we mentioned, President Ramaphosa will address the nation at 8 p.m. this evening on the country's efforts to fight COVID-19. His address follows a National Coronavirus Command Council meeting. South Africa has entered the third wave of COVID-19 pandemic with well over 8,000 new infections being reported per day. The Ministerial Advisory Committee on COVID-19 has expressed concern about these numbers, calling for action from government. Acting Minister of Health, Mmamoloko Kubayi-Ngubane, during her visit to the Bara Hospital in Soweto over the weekend, said they were looking at imposing further restrictions on provinces like Gauteng, the Free State and the Northern Cape. SABC News Political Editor Mzwandile Mbeje joins us now to talk a little bit more about this. So, Mzwandile, let's look at the expectations. A tough crowd to please, especially given that he was criticized, the president that is, leaving the country in what was said to be a crisis and darkness and the rising figures of COVID-19. So just how bleak a picture is going to emerge from his address, do you think?
A very good evening, Tsepiso, and to the viewers. Indeed, this is not a pleasant time for the country's number one, because he has to make those tough decisions, and of course against the background of a very, very sluggish economy. When you look at what has been happening recently, as you have mentioned, Tsepiso, in your introduction there, you can see that if nothing is being done, the situation will simply spiral out of control. Yes, at the moment, the province that seems to be the key driver of this third wave is Gauteng. And Gauteng is quite important, Tsepiso, and you know, not only is it the economic hub of the country, Gauteng has the biggest number of people, the largest number of people lives here. And of course, if this province then struggles, it will be very difficult. You look at what has been happening in hospitals and what the provincial leadership has been saying. So clearly, the president needs to take that into account. And I will not be surprised tonight if he indeed announces those tighter restrictions, even if perhaps not the entire country will be covered, but this hotspot, which is Gauteng, is certainly firmly in his sight.
So, Mzwa, with these consultations that he is having, obviously it's across the board, as I mentioned, that he's just also come back from the G7, where he would have gleaned from international best practice on how to deal with this issue. But there's also the issue of the economy. You can tighten the restrictions, but you don't want to interrupt what has been an uptick in growth. So just talk to us through about just how tight can he get?
You know, it's quite important that you mentioned the fact that he's been at the G7 in UK, where he interacted with some of those countries who are actually very successful in vaccination programs. You look at the host country, UK, it's actually one of the countries that has really done, very well. Particularly if we look at that example, Tsepiso, of UK. On the 21st of June, the restrictions were supposed to be lifted altogether because the country felt they had done enough in terms of vaccination and curbing infections. But because of the variant, the Delta variant, the one that was first discovered in India, it has come to many areas in UK. They decided that let's postpone by 4 weeks. And then the argument, because I was listening, to say, they were basically saying, the scientists there, to say, yes, we understand the economy is under stress, but the advantages of extending the lockdown far outweigh the disadvantages. So let's come back home. Yes, we are worried about the economy, but look at this. Right now, the hospitalizations are increasing at an alarming level. So if nothing is being done, so the health system will be completely overwhelmed. So who will benefit from that? The people who are supposed to work that economy, if they are sick, it's really pointless. I think the president will have to really strike a very delicate balance here to say, yes, I don't want to close the economy completely, but of course, the people who work that economy need to be protected. I mean, the evidence on the ground, particularly here in Gauteng, is that hospitals are about to be overwhelmed, and then the deaths are quite rising. So something must be done. And I think that's what we'll see happening tonight.
I'd imagine that he will also try and infuse a bit of triumphalism in his speech by saying, I did speak to world leaders and they listened because they have made commitments in donating vaccine doses, and there's a growing partnership on how to, capacitate South Africa to be able to do that.
South Africa has been the leading voice on the continent. What made that possible, not only because of the position it holds, being the most advanced economy, obviously, on the continent, the fact that when this pandemic hit, Tsepiso, the president of South Africa was the chairperson of the AU. So he had the responsibility really to oversee the overall strategy of the continent as to how to fight this pandemic. So from then on, so he's been able to be consistent in terms of what needs to be done. And the fact that he was able to get some of the concessions in terms of the donations of the vaccines and perhaps the issues relating to the TRIPS waiver, so does tell you that indeed there is some level of satisfaction he may have had after engaging with those leaders. Of course, not getting everything that we would have wanted as the continent, but the fact that somehow some steps have been taken and they appear to be successful, so it's definitely a shot in the arm.
All right, thanks, Mzwandile. Of course, we'll speak to you later on. SABC Political Editor Mzwandile Mbeje, the President will be addressing the nation at 8 p.m. and will lay out the land in terms of the pandemic itself, how it's progressing. You've heard Mzwandile say Gauteng is now shouldering a bulk of the new cases, a 67% increase. We'll be looking at that shortly.